third scenario. Any other questions? A very good question. The last question. Thank you, Dr. Watson. Any other question? So you got the answer, right? I'm sorry for in between the interruption.
Yes, ma'am. Yes, ma'am. I got the answer.
Okay.
Thank you, ma'am. Thank you.
So that's why, because you cannot tell the patient the name of the drug when you are just, I mean, consulting with about the drug interaction with the mentioning the name, right? That if you are taking erythromycin or if you are taking some ketoconazole effect with this drug, no. So what you have to do if you are going to take any new medication, please consult with your physician or consult with us, because this medication has some drug with other drugs, some specific drug has some interaction. So like this, you need to tell. Okay, you don't need to tell the patient that you will have with this drug, because he cannot remember, he or she cannot remember. So in a generalized term, like how we are consulting with our patient, that's what we will do. Okay, so that's about this last question answer. Any other question? Otherwise, I will go for the second scenario. Any other question, please?
Thank you, ma'am. Thank you, ma'am.
Welcome, dear. Repeat the reply. Should I reply, Dr. Tijas? Have you got it or not? Have you got it, dear? Because I was interrupted by reply for which one? Reply for which one, dear? Reply for drug interaction. It's not the question they will ask. You have to tell the patient about the drug interaction, like a safety netting. What you are going to do, a safety netting, that if now as we are going to start with this statin tablet, this medication can have some, with some other medication, some interaction. This can be disrupted. Okay, the mechanism or this medication work can be low down, or the other with other medication it has some interaction. So in that case, please, if you are going to start any new medication, consult with your physician or consult with us, or tell your physician that you are on statin. Okay, that's it. Clear, Dr. Tijas? To inform the physician that you are on statin. Well, okay, well, so that's it. The main the term is inform your physician that you are on statin, so that they can be careful about introducing another medication. You don't have to mention which drugs in drug interaction, and because the patient cannot remember at all, right? So this is the thing. Please be careful about the videos, dears, because this has been recorded. So please be sure that all of your videos are stopped. Okay, thank you so much. So any other question, or we will go to the next one? Any other question from anyone? It's already we are late. So, okay, so we are going to the fourth scenario. Dr. Hiba, are you there?
Yes, I am here.
Okay, so here is your scenario. After 2 minutes, I will put it away from the screen. Okay, dear? Take your 2 minutes from now. And all of you also try to take the note down. Okay? And please stop the videos. I can see actually some videos are on. Please take care. Stop the videos, because this session is being recorded. Okay, thank you. And please, it is Mr. Sharon. Should I can edit that? Edit that. Oh, I'm sorry. Cannot edit it. Okay, just Mr. Sharon. Okay, this is not Mrs. I'm sorry for typing mistake. And Mr. and Mrs. This is very important. If it is a she or he, or even transgender, so you need to be very, very careful that how you are going to how you are going to call him, how you are going to talk with him. Okay, so this is very important. Usually with transgender, they didn't give direct communication, but even if they're giving, they will mention you that they, he wants to prefer himself as man. He wants to keep himself or introduce himself. He prefer himself to be a man, to prefer himself to be a woman. So in that case, you need to mention as they have mentioned. Regarding the transgender, as a transgender patient, they didn't have any case till now, but there was a case that was with one transgender. The patient was there in the same room. The patient got angry. She was female, and actually the patient's son was there. He was talking. He was angry that my mother doesn't want to live with that transgender because he is a male. But in that case, you need to convince him that even if he's a male, he prefers himself to introduce him as a female. So we should respect their identity, how he likes to be introduced, okay, or he's thinking. So we have to respect their identity, what they're preferring. So in that way, one case was there. But yes, that is one diet actually. Later on, it didn't repeat. But directly as a patient transgender, no, I don't think that any transgender as a patient it came. I just mentioned so that you have to be, very cautious that it is Mr. or Mrs. Okay, that's it. Clear, Dr. Tejas? Is it clear? Okay, welcome, dear. I'm sorry, in between we disturbed Dr. Hiba a lot. I hope you get. Whenever you are ready, please tell me.
Okay, I'm ready.
You are ready, huh? Okay, so let me take just 8 minutes. So 8 minutes start now.
Hello, good morning.
Good morning.
My name is Dr. Hiba, and I'm a doctor in the medicine clinic. Am I talking to Mrs. Sharon, 45 years old?
Yes, doctor. I'm Mr. Sharon, 45 years old.
Okay, Mrs. Sharon, we are here to talk about your health condition. Is it a good time to talk?
Yes, please go on.
Okay. Before we start our meeting today about your health condition, please tell me what do you know so far so we can be on the same page.
Actually, what happened, doctor? Before 3 months, actually, I came here. I was severe chest pain, so I thought I had a heart attack. So I came here. They did some heart tracing and some jelly scan, and they told me that I'm totally fine. This is not any heart issues, and they told me that I have some problem with my acid. It is coming up, something like they told me GERD. So they have given me some medication actually. So at that time, this along with this, also they found that the fat level in my blood it was high. So they have given me both the medication, doctor. Yes, after that I was taking that for that acid drug, that antacid type drug. I am taking that. But doctor, I'm not taking that fat lowering medication. So they did the checkup today again about my fat level. So I don't know what is the result, doctor.
Okay, Ms. Sharon, I appreciate your knowledge about your health condition, and I'm glad that you told me about that. Ms. Sharon, can I ask that what is your main concern with why you're not taking that fat burning?
My main concern is that, doctor, I don't want to take this medication, and if my result of this last, I just did blood test again for my fat level. So if it is normal, then okay, I will not. I will continue not taking it.
Okay, Ms. Sharon, I respect what you are saying. Can please let me explain to you more about why our consultant have started this fat lowering medication.
Would you please tell me, doctor, now what is the result of my last fat level?
Your last the result of your last test, it showed that you have raised fats in your blood
Oh
level.
no,
And that
again.
this was very concerning, and that is why our consultant is of the view that in your best interest, you should take this medicine.
But doctor, can I just go with, because last 3 months, I don't know why it is still high. I tried very strict diet and I went for very much heavy exercises, cardio I did. So, doctor, I don't like it. I have started, I have started that when he prescribed. But that time, I felt like I have some side effect.
Okay, please tell me, what do you felt at that time?
Yeah, I had some muscle pain, and that's why I went to the internet, and I have found out that this medication is very bad drug. I don't know why did you give me? Your consultant has given me. I'm really angry because I have seen that it can have the eyelid can drooping down, and it can have one disease that is known as myasthenia gravis. And my cousin is having this myasthenia gravis. So you guys even know that, but I don't know why still you have prescribed me that one. So that's why I stopped it, doctor. I don't want to go for that one. I don't want this myasthenia gravis. I have seen my cousin. Very bad effect.
Okay, Mrs. Sharon, I appreciate your concerns, and I can see that you are very worried about this condition, and you are genuinely worried about that. Look, Ms. Sharon, when you were started on this medication, it was in your best interest according to the guidelines. And yes, you are very right that you started having these muscle cramps. It is a documented and known side effect of this medication. Actually, uh, uh, many patients who get
Dr.
this effect.
Hiba, your voice is breaking. Can you please come near to your microphone or maybe?
Okay, can you hear me now?
Yes, now it is clear. Yes, it is.
Okay. Ms. Sharon, when we start this medication, many of our patients get this side effect. So you're very right in telling us that you get this muscle cramps. The thing is, if you have told your doctor that your GP that you are having these muscle cramps, we would have normally reviewed the medication dose. And what we do is that we run some blood tests and see that if there is some really problem going on in the blood, which is causing these muscle cramps, and we can lower the dose of the medicine. But uh, actually, taking this medicine has far more benefits than this. The risk of having muscle cramps can be dealt with by lowering the medication, by stopping it for a while, and then restarting it at a lower dose, and by continuously monitoring you. Are you getting
Yes,
me?
doctor. Yes, doctor. I'm getting you. But what about this myasthenia gravis? It will cause myasthenia gravis to me. What
Okay.
about that one?
Okay, Ms. Sharon, I appreciate your concern, and I can see that you are really worried. This drug can cause myasthenia gravis, but it is a rare side effect. And are you having any history of any weakness, any fatigue, or anything like that?
No, doctor. I don't have like this, but I have seen in the internet that it can cause.
Okay, it cannot cause that problem. It can aggravate this problem in some person who is already having this disease. Are you getting me? So
Oh,
if
I see. I mean, who is having this disease, they can aggravate, right?
yes, so that's why I was asking you that if you have any problem like any tiredness or any fatigue at the end of the day or having drooping of your eyes or anything like
No,
that.
no, doctor.
So,
I don't have
so if
any of this.
okay, if you're not having any of these problems, then it is very unlikely that this drug which you were started on and caused this myasthenia gravis.
Okay, doctor. Okay, then maybe I can start. We have 18 seconds left.
Okay. Mrs. Sharon, any other concerns, any particular reason that why you don't like this drug, apart from these reasons?
No, doctor. Now I'm agreed to start on this medication.
Okay, Miss Sharon, I would like to
I'm
give you
finished.
some.
Continue. If you.
I would like to give you some reading materials and links of website where you can further read about the complications of this drug, if you have any. And you can. I would also like to tell you that if you have any yellowing of your eyes or any rash on your body or any severe muscle cramps, please, after starting this medication, please contact your GP immediately, and we will also follow you up from time to time by running some blood tests to see if you are having any side effect of this medication.
Okay, doctor. Thank you so much.
Thank you.
Very nicely done, Dr. Hiba. Well done. Very nicely done. The main concern, it is almost the same scenario. That's why I choose the scenario side by side so that you can understand the difference between these two. Let me share the scenario again. Sorry. Is it? So see here what happened. First, let me talk about your performance, then we discuss. Okay. So obviously it was a very nice performance. You did everything nicely. You introduced yourself, and then you were asking my expectation and told you. But in between, I think you maybe the writing or somehow you didn't get that actually before 3 months they did one time the fat level. Okay. Now again, now this time also when he came, they did the cholesterol level again. Okay, so this time also he's having still high level, and that's why he's here. Because you asked me why I'm here. I'm here because I can't you see the screen still?
Okay, yes, I missed that line actually in reading the scenario.
Yeah, I think the scenario. Yeah, now it is showing. Okay. So this is the thing that my expectation was actually the test result and that I'm not taking it. Okay. So whenever the patient concern, whatever the concern, try to meet it first. My expectation you asked me, and then you jump to that session. Asking me that why I'm not taking. You were interested about that part, but meet my concern first, right? That yes, this time also you are having the cholesterol high. So you missed that part. I again ask you, tell me about
yes, I have to.
yeah.
I had to inform him that the results are concerning and
yes. Yes, the pause, and also that because my expectation is he will tell me that what is my test result, because I'm not taking. I know that I'm not taking. That is the small mistake I think in between I got, and other than that, you told me everything very perfectly, all the side effects, and regarding the issue about this. This is actually the twisting part, and the scenario is so bizarre. So it came in that way that the patient came with non-cardiac chest pain, and then they told that it was GERD, and then they have started with PPI. At the same time, they have cholesterol level also they got high. So it was so bizarre scenario. So the main theme was that it is about talking about that the statin, why he stopped, and you should be adherence to it. Why you should be adherence? That if you are also the risk that if you are not taking it, there is a chance that you can have the future that you may have heart attack, you may have stroke. The same thing, the risk factor you need to mention. Okay. And regarding the MG question, she answered me very nicely that myasthenia gravis is only, it is the very rarest and very unwanted side effect. And usually in those patients who are already having MG, they can aggravate. But in a new patient, it can never happen. Okay? So this is the thing you should explain. And that's the part she explained it to me very nice. That whoever having MG, they can have the aggravation, but you don't have MG. But the one thing that in between, you were asking me that if I am having any drooping of eyes or anything, don't ask me directly. That is also a part of history taking. But later on, the way you told me that if you feel like there is drooping of eyelid, you are having the muscle weakness in a indirect way. In that cases, please come to us. These are the signs that myasthenia gravis people are having. So if you feel like if you are having any of this in future, please come to us. Because already they have evaluated her that he doesn't have evaluated him that he doesn't have MG. That's why they have given the statin. So from just sky from the internet, he read about that one, that MG can happen from there. His cousin is also affected, so he knows about the disease. That's why he's affected. Okay, so just don't take the history directly that if you have a this or that, because already the consultant knows he doesn't have the MG. That's why they have already started on a statin. Okay, dear. So this one. Okay, some doctor is asking, can statin unmask undiagnosed MG? Yes, that's why she did the safety netting. That if in the future, if you get like this, please come to us. That's why the safety netting is important. But it's not your duty to diagnose if she's having MG right now, because already she's diagnosed that he didn't have any MG. He only had this cholesterol level high. That's why statin was introduced. Okay. Other than that, very nicely done, Dr. Hiba. You answered all my concern very nicely. And this scenario is mainly about that one. Even here, actually, it is very difficult because the concern, making him convince that to take it, to get adherence to it, that was the main portion. So here, even if you don't get about timing of smoking alcohol, this is not specifically needed if you don't have time. The major part is adherence. But yes, of course, if you do have time, you can go with your the social questions, obviously the smoking, alcohol, and also the job. Okay, and diet, exercise, again, to maybe already he was advised before, but if you do have time, one line, maybe you can tell that at the same time, please try to stick adherence to the diet and exercise you were doing, but please start to have this statin. And once I'm agreed that, okay, I will take it, don't ask again, is there any other reason? No need. I'm already agreed. I'm convinced. If I'm convinced, why you are asking me again? Is that clear, Dr. Hiba? At last you ask me again. So if I'm agreed that somebody is asking for DAMA, and I'm agreed that I will not go for DAMA, I will discharge on against medical advice. So I agreed, no, okay, I am agreed that I will stay in the hospital. So in that case, again, you are telling, why did you want to go? Because already you have convinced me to stay. So don't need to ask again why. But till the patient is not agreed, yes, you need to ask why. So you did very perfectly till I'm agreed. But when I'm agreed, don't ask me again. I'm agreed already. Okay, doctor, I will start it. So now you could use that time that with other, maybe with smoking, alcohol, and also the brochures, like that you could use those 1 minute. Okay. But very nice, dear. Thank you. It was very nice. Thank you, Dr. Hiba. Any question? Yes,
no, thank you.
Welcome. Nice performance. Both of you today, very nice performance. Any other question from there, from drug introduction?
Ma'am, so the scenario of Dr. Hiba, the takeaway points are like you are concerned about this myasthenia gravis, right?
Yes.
And she had to tell you that it's a very rare thing. It never happens. And you need to continue.
Yes. And it never happens to normal people who already
Never
have
happens to
this.
normal.
Yes, who already have this or have maybe not diagnosed, there that time only it can happen. So you will continue, and if you see safety netting, if you see in the future like this, with dropping of your eyelids, if you are feeling any weakness in any part, difficulty in combing your hair, difficulty in from sitting to standing position, like MG, all the symptoms, maybe 2 or 3. It's not like all the symptoms you need to tell. 1 or 2, even only with drooping of eyelids, what he was concerned. You can tell. If you see in the future like that, anything, please come to us. We will evaluate you at that time.
Sure.
Okay. This was the scenario. The scenario was to convince him that yes, this cannot happen. So don't get like that. Yes, this can happen. Or why you are having maybe you are having MG or not. Some people here. I know one examining what she did actually. She was starting to take all the history of MG. So she lost that case totally, the communication, that she was going deep down that if the patient was having MG or not. But this is not your duty actually. Here only the duty is that already you need to believe that the consultant has evaluated, already screened him. So the consultant knows he doesn't have any symptom of MG. That's why he has started. So you need to believe blindly the consultant decision. So it is not your duty. This is not LCC. You don't need to dig down if the patient is having MG or not. Okay, so this is the thing. That's it. Thank you. Any other question? And here, the medication. Here, actually, you see the protocol of medicine introduction we didn't follow. Why? Because we didn't have time actually, right? We will not have time in this case because already the patient knows. Last session, the consultant when started the dose, the side effect. I mean, the advantage, disadvantage, all 6 points already discussed with him. So now this scenario is not about discussing about those 6 points. This scenario about convincing the patient that you have to be adherent to it. Otherwise, there is risk of heart attack or stroke in the future. The fat level will grow up. It can have so much risk. It can threaten your life. So make him afraid and let him restart the medication and assure him this is not going to cause him MG. Okay, that's it. Okay. So if any other question we will take, otherwise we will end the session. No questions? Okay. So inshallah, next welcome dear. So inshallah, next session as early as possible. I will try to be very regular, inshallah, so that maybe 1 or 2 communication each day if we are doing, we can do a lot. Okay. And try to participate. Thank you, Dr. Moazem, Dr. Hiba.
Thank you so much, ma'am. Thank you.
Thank you. Thank you so much. Both of you did very well. Thank you. Okay. Hope to see you again in the next session. So we are going to end this session. All of you, good night. All the best. Assalamu alaikum. Thank you, Dr. Hiba.